Hello and welcome to the Community Voice. I'm Fara Sax. Joining me today is Dr. Amy Boyers. She is the president and co-founder of Galen Hope, which is a mental health treatment center right here in Coral Gables. Thank you so much for joining us.
Thank you for having me.
And it's such an important subject and topic, and so many people are affected by mental health issues. So I'm so glad you're here today, and that the treatment center is available.
I'm very happy to be here. It's a very important time to be talking about these issues, and I'm very excited to introduce Galen Hope to the Miami community.
And you just opened really recently, and it was during the pandemic in
Yes.
2021.
Yes, about a year and a half ago, we opened up.
So how did you get to this point? Because you have some really important partnerships and with Dr. Oliver Pyatt, and so let's walk through that.
So I met Dr. Wendy Oliver Pyatt about I would say about 14 years ago, when she was opening a different treatment center here in Miami. And I worked with her as a consultant for about 10 years, and I helped develop a variety of programs. And ultimately, she and I developed an adolescent treatment center for girls with eating disorders as a sort of an offshoot of the program she initially opened. And we found that we really worked well together and saw eye to eye on the way that we worked with clients kind of philosophically. And so over time in my own private practice, I saw that there really was a need for more complex, more sophisticated mental health treatment. What I saw in my own practice was a lot of clients with a variety of diagnoses, not just eating disorders, who were really struggling to get well. So they might go out of town to a program and then come back to Miami, and there really was nothing to help to support them in that process of transitioning out of treatment into getting well. And so Wendy and I got to talking, and what can we do for the city of Miami? What can we bring that's new? And one of the things that she and I really saw eye to eye on was the use of the PACT model, Program for Assertive Community Treatment. And that is a community psychology orientation to providing treatment that really has not been used in eating disorder treatment at all. And it's a model that involves the least restrictive environment. So in 1993, there was a Supreme Court decision called the Olmstead decision. And in that decision, the Supreme Court decided that funds being used for people with severe mental illness to keep them in institutions or in programs could be used to put them into the community and allow them to live in the least restrictive environment. And so in these PACT programs that popped up around the country, they would bring in teams of people to work with these clients who may have been living in some kind of long-term care facility, separated from their families, outside of their communities. So they're brought back home, maybe to live with family or to live on their own. And they brought social workers and psychiatrists and therapists to the clients to help them return to a better level of functioning and to allow them to live in their own communities. And there was a lot of success with these kinds of programs. And so Wendy and I both had experience working with clients in this way. So she actually founded the first PACT program in the state of Nevada. And I also had a case management business alongside my private practice, because I just found over the years that there were clients that needed more support, more kind of real life exposure to different activities that they might need to get a little bit more skillful at doing in order to return to a higher level of functioning. And so she and I saw really eye to eye on the idea that treatment doesn't just happen within the center or in the office, but that to really help people get well, you really do need to walk arm in arm with them through a lot of the challenges that they face once they leave your program or once they leave your office. And so for so many clients, they may do really well when they're in a treatment center, but then they return home and they're facing maybe problems that they left behind during the that developed in the course of their illness, or skills that were never developed during the course of their mental illness, because for a lot of people, these issues begin maybe in early adolescence, late adolescence, and so they start to fall behind. And there's a lot of shame around the fact that there's just basic life skills that they just don't know how to do because they weren't feeling very well for a long time. And so they may be cut off relationships, simple things like how do you open a bank account? How do you get your prescription called in? How do you let a doctor know that you've run out of your medication? Simple things like that. How do you write a check? I have worked with adults who don't know how to write a check and they're embarrassed to admit it. And so these are simple things to teach someone. And if you can normalize that experience, that it makes sense that you might have difficulty with these kinds of tasks. And we know this is going to be an issue. So we want to work with this with you now in the beginning of treatment. So that by the time you leave, you've done a bunch of real world exposures and we have gone into whatever that environment's going to be for you. If it's going back to school, if it's going back to a team sport, if it's helping you to find an apartment or find a part-time job, whatever it may be, we will help you with that. But that's a part of the treatment. It's not something you do once you leave. I think that's really where a lot of treatment centers fall short, is they provide their treatment, the patient comes to us, we give them all this great care, and then you're done. You've met your goals here, but there hasn't been any real world testing. Can those skills generalize back out into the real world?
And also you're dealing with people that have families and they have relationships that don't understand. So what at Galen Hope, are you training also the families or partners,
Right.
Friends,
Absolutely.
children that can really like help mitigate the slide back?
Right. I think for many years, the thinking at treatment centers was, give us your loved one, we'll take care of them, and we'll send them back when they're better. And what they found was that people would go home and families would fall back into a lot of the same patterns. If someone has struggled for a long time with a mental health condition, there's a slow adaptation within the family to dealing with that problem. People start to pick up the slack for that person who's struggling to be well. And so part of the work is helping the families find a new way to relate to this person as they start to get well. The families are also kind of traumatized. They've been through a lot as a result of what their loved one has been through. And so we have to work with the families on educating them about what's going on, teaching them ways to work with their loved one in a way that's more productive and helpful. And it's not that people are doing this on purpose. They've learned to behave this way because they're trying to support this person, but they don't have the knowledge or the skill set to support them and get them better. So what they do is a lot of things that often wind up accommodating the problem and kind of enabling the problem without realizing it. So I'm not saying this is on purpose. It's just they're trying to keep all the balls in the air and try to keep the person feeling as kind of safe and comfortable as they can with their own limited knowledge at that time.
So it's good to know that is really it's a community within the community of
Absolutely.
their own, those that are surrounding those that have been suffering and trying to just get back on their feet. So what do you treat over at Galen Hope?
We treat a wide range of diagnoses.
And you're located in the center of Coral Gables.
Correct. We're located in Douglas Entrance, historic Douglas Entrance. Many of you may be familiar with that landmark.
Maybe we should just show exactly what that looks like.
There it is.
Oh, beautiful.
Yes. So we're located in Coral Gables, which is really nice because we're in Coral Gables. So when we start to do some of those real world exposures with clients, there's a lot of places right nearby. We can go to restaurants, we can go to stores, we can take them grocery shopping. So there's a lot of ways in which we can work with them right in the surrounding community. Mm-hmm. Yes. There it is again, very nice, very peaceful. And sometimes our therapists will just walk around the plaza with the clients or sit outside and have lunch with them so they can get out a little bit. So it's very pretty. Mm-hmm. That's a picture of our waiting room.
So you have a center, and then you have a residential.
We have a residence. We are not a residential program,
right? We have a home,
but we do offer housing for people that require that.
That are coming out of town.
People coming from out of town, or for clients for whom it makes sense developmentally for them to get out of the house. You know, for these emerging adults who maybe have been struggling for a while, sometimes it's helpful for them to live with us and not with the parents, to help them transition to a more independent life and try to kind of break some of those patterns that have developed within the family.
And what I'm noticing is it's very peaceful, very serene, and very calming. We can go to the next.
even though we're in a traditional office building, you can see here, this is one of our group rooms, that we really don't want it to feel like an office. And people who come to our center are always really, really pleasantly surprised how homey it feels, and how sort of aesthetically pleasing it is. We put a lot of thought into that. We don't want it to feel clinical at all.
Mhm.
That's one of our dining rooms. That's actually in our house.
And where's the house compared to
the
where
house
the
is
center is?
less than a mile from the center, so it's very, very close. It's also in downtown Coral Gables, and so we do offer housing for clients that might need that or want to take advantage of that. And that's our kitchen.
Very nice.
Yeah, it's nice. This house was recently redone. That's one of our bedrooms.
Very welcoming.
Yes.
Very warm, very calming, and
Right.
coming from a situation that probably is very high energy and very, very stressful. It's good to have that
Right.
namaste feel and
Right.
calming effect.
You know, families who call us are really in a state of chaos and turmoil. They really, they're so afraid. They don't know what's happening to their loved one, and they don't know how to stop what's happening. And a lot of clients who come to us have had other treatment experiences. They've gone to other treatment centers, and maybe that hasn't worked out, or they got better, and they fell back into some old patterns. And so people often are coming to us looking for a different experience.
And what do you treat there? What?
So we treat eating disorders. So about half of our clients have a primary diagnosis of eating disorders, and the other half have other mental health diagnoses, often depression, bipolar, any form of anxiety disorder, social anxiety, OCD, phobias. A lot of our clients come with trauma, either in our mental health or in our eating disorder track. Trauma is pretty common for most of our clients. And even if people haven't had necessarily something that you might consider traditionally traumatic, a sexual assault, a car accident, there's lots of little traumas that people experience in the course of their lives: bullying, losing a friend out of nowhere, being excluded. These are sorts of traumas that people don't always feel like they can talk about, because they don't necessarily they don't match up to like being in a terrible car accident or something like that. But those are traumatic, right?
Yeah, whoever is processing it, that's important
Right,
to
it's
them.
traumatic to them.
Right.
Mhm.
And how old are the folks that come visit
So
you?
our adult program is all genders, 18 plus, and our adolescent program it's about 12 to 18. About 12 to 18. You know, we would consider someone a little younger depending on their presentation. So we really do a very careful and thorough admissions process. So when someone calls us, sometimes people will call and say, "Oh, I don't know if this person's the right fit for Galen Hope." We always say, please have them call us, because when we listen to the case and we take our time, we have multiple conversations with someone before they come to Galen Hope. We talk to their family, we talk to their treatment providers. So if they have any testing materials, we have them send it to us. So we do a very thoughtful admissions process. So we begin to prepare for our clients before they ever enter our program.
And what I find it was intriguing is there's a whole questionnaire. I was on the website, and it was just asking a lot of questions, and it made me think about certain things in my own life. And I think that's really important, just to have that initial opportunity to like have the patient think about what's going on inside of them. And it's interesting, in the community, there are people that say they deal with eating disorder or they deal with mental illness, and it's not, they say, come, we'll work with your child, but it might be more detrimental than it is helpful. Is that what you're seeing sometimes, that you're getting the overflow of that?
We definitely get people who have worked with professionals who maybe aren't as specialized as they needed to be for this case. Oftentimes those professionals recognize that and send them our way. But certainly eating disorder treatment is a specialty, and it takes many years to learn how to do that.
Let's talk about some of your background. Like, how did it come? I always am fascinated. How did it come that you wanted to work in a eating disorder arena?
So I always knew that I was interested in eating disorders, and I just didn't know how to get there. It was something even before I went to graduate school.
And you're local. I mean, you're local.
I'm from Miami, went to went to Gulliver,
Dr.
and
Gulliver.
and
Shout out to Gulliver.
right, thanks Gulliver.
And the University of Miami.
And I did my master's and my PhD at University of Miami. And at the time that I graduated, there was not any eating disorder treatment center in Miami.
And how many years ago was that?
That was in 2000.
And you are only 25. I love it.
Right, exactly.
I'm 26 and you're 25.
Right.
Yeah.
So, but when I was going to do my postdoctoral residency, the Renfrew Center opened up a step down facility in Coral Gables. And so that was where I was able to first get some real eating disorder experience. I had done my internship at the University of Miami Counseling Center, where I started to see some of those clients. And again, I knew I found it really interesting, and I was beginning to work with them. Then I had this opportunity to work for the Renfrew Center. I did a postdoc with them. And then when I went into private practice, by chance, I wound up moving into the office of two people who were like two of the first people ever to treat eating disorders in the United States, Roy and Elliot Ehrlichman. Elliot died a number of years ago, but for years I trained with them, and they sort of helped me get into more of the eating disorder treatment world.
And it's serendipitous. It's not, there's no such thing as an accident. You
No,
know?
I think I had met Roy because I was working with one of his clients when she was at the Renfrew Center. And so we had gotten to talking, and he called me one day and said, "Do you know anybody who wants to rent an office?" And I said, "I think I want to rent an office."
And it was right in that office that you,
Yes.
for how many years were you in that office in
I
South
was in
Miami?
18 years. 18 years until I moved over to Galen Hope a couple months ago. Yeah.
It's crazy.
I know.
And how many people do you treat in where at Galen Hope?
So we can go up to about 15 in each, the adult and the adolescent programs. So in general, we don't really split the mental health and eating disorder clients, except in certain services. So at mealtime, the eating disorder clients have nutritional support and behavioral support at the meals. That if the mental health clients don't have any kind of eating disorder issue, we aren't going to, be keeping such close tabs on what they're eating or not eating. And then like body image group, like if someone's really not coming in with any kind of disordered eating or body image issue, they don't have to attend that group. So certainly somebody that is not coming in with any issue related to body image or food, which by the way, a lot of people come in on our mental health track saying they have no issue with food or body image. And after hearing all the conversation, they're like, oh, maybe there is a little something there. Or maybe this was an issue in my family and I never really realized how much it impacted me. So our clinicians, our team is very, very astute. And if something's going on with someone's food, typically we will notice it. But if there's no issue there, they aren't going to be subjected to the nutritional protocols. But there's a lot of groups that they have together. And I think that that's really nice to not necessarily be segregating people so much by diagnosis, because at the end of the day, they have way more in common than they do different. And so I think there's a lot to be said for that kind of crosstalk and not siloing people based on one diagnosis. And one of the things that we saw in the field was that there's eating disorder programs and there's psychiatric programs. And the psychiatric programs don't want to take anybody that has any hint of disordered eating or eating disorder history. And oftentimes people with eating disorders or who have sort of semi-stable eating disorders, when they're put into a psychiatric program, as good of a program as it may be, they know they can get away with behaviors there. And so what we find is that kind of treatment center merry-go-round, they wind up going back and forth. So they may stabilize the eating disorder in an eating disorder treatment center, but there are these deeper, more complex issues that are really driving the eating disorder that they aren't addressing at that higher level of care at an eating disorder facility. And then they can't really do the work at a mental health treatment center because we don't take people with eating disorders. So we are getting a lot of people who kind of have one foot in both camps, semi recovered with the eating disorder, but there's still a lot of thoughts or urges, or maybe a recent relapse, and people who just have more complex issues that take a little more time to understand and to unravel.
And tell me about the clinicians. Tell me about who you're working with that help along in getting the program and treatment.
Sure. So we have a team of therapists. We have a number of doctoral level therapists. We have master's levels clinicians. A number of members of our staff have worked in the treatment center world, eating disorder world for well over a decade. We also have very important people who work at our center called care partners. And every person who comes to Galen Hope is assigned their own team. And so, again, as I said, through that very thoughtful admissions process, we look at what is this person really needing to accomplish when they're with us, and who on the team will be the best fit for that. So we assign them a therapist, a psychiatrist, a dietitian, and a care partner. And the care partner is that person who does the real world exposures. The care partner is there every day in the milieu interacting with the clients. They facilitate the meals. They make sure they get from group to group. They do a lot of check-ins during the day, but they also are the ones working on goals, life skills, making sure that you're practicing. So it could be something as simple as they'll come over and help you fold your laundry, or teach you how to cook a couple of meals that are simple for a college student, or help you write a resume, or make sure you know how to fill your medication. So there's a wide range of things that they can do depending on what the issue is that the person has. For our eating disorder clients, it may be going to their home and eating some meals with the family and watching what kind of behaviors happen when they are at home that are not happening with us, so that we can coach the parents on how to more effectively support that person during a meal.
It's wonderful, because it's such a gap for those that are with families and the poor.
They're totally overwhelmed.
How do you deal with it? How do you track it? How do you get them back on track and get yourself in a good groove too, I would imagine.
Right. And sometimes it's just that they need someone to explain to them, actually what you're doing isn't effective, right? We know it's coming from a loving place, but it's not effective.
Just eat.
Right. Exactly. Yes.
And what happens, is this a day program? Is it go on for 4 hours, 5 hours? And what's the length of time of an average treatment program for someone with you and Galen Hope?
We have 4 tiers of care. Our highest tier of care is our 12-hour partial hospitalization program, sometimes called day treatment. So for clients really needing that level of support, people who are really struggling to function or who need all of the meals supported, they can be with us 12 hours a day, 7 days a week. We are open every day of the year, even on holidays. So for people that need that kind of treatment, and what's nice is because we are a partial hospitalization program, for some clients, for various reasons, they don't want to be in a residential program. They like the idea of being able to go home at night, whether that's to be with their families or stay in their own place. Some people have had negative experiences in residential treatment centers, but they need that level of intensity. And so this is a way of giving them that level of intensity of the treatment, but them being able to live on their own. So that can be for some people who maybe have had treatment trauma, for some clients who are maybe have gender identity issues, or who have felt uncomfortable in other treatment centers because of their gender identity issues. That can be a way of helping them feel safer to get the treatment they need. So then the next step down is our tier 3. That's our 8-hour PHP. So that is
PHP, explain what that is.
Partial hospitalization program. And that's usually from 11 to 7. Sometimes we will flex a little bit. For example, if someone's in college and like they are taking a class in the afternoons, we might have them come from 8 to 4, and then they can go to class in the afternoons.
Is ever a time when a student possibly has to stop going to school, or a young adult has to stop working?
Yes. I mean, we always try to support the highest level of functioning that's possible, but sometimes the energy that is needed to keep you functioning in school or at a job is going to take away from your ability to work on yourself. So sometimes people do need to take a break. Unfortunately, we don't like having to put people in that position, but that is a reality for some people. That in order to really make the most of the treatment experience, we need you to kind of stop and be free of other responsibilities before you go back into that world. Our next step down is our tier 2. That's what we call our high intensity intensive outpatient, which is usually about 4 hours a day. And then the next step down is just what we call our regular IOP. And that intensive outpatient is 3 hours a day. And once people are stepping down into our intensive outpatient, or if that's the level of care that they enter at, that tends to be a more flexible schedule because we're so focused on having people be reintegrated back into the community. We are mindful that they may have other things that they're doing
Right.
that are important. And so we try to build a schedule around that.
And what if, I know we have only a couple of minutes left, but
Mhm.
what is the next step? Someone is considering, thinking, they see something, something is not right. What would be the next step? How would you suggest to engage Galen Hope to help?
That's a great question. Well, there's a couple of ways. If you're working with a therapist or a psychiatrist and you feel like this is not cutting it,
What does that mean, not cutting it?
Like, I'm not meeting my goals. I'm not progressing in my therapy. I feel like I'm getting worse. I'm finding it harder and harder to function. Maybe you're isolating, you're letting certain responsibilities fall by the wayside because it's just too much of an effort. If you're starting to feel an increase in hopelessness, if you're feeling like things are getting too hard, first and foremost, certainly bring that up to anyone that you are working with, that maybe you might need a higher level of care. You can also just call us directly at Galen Hope. We offer a free consultation to anybody that calls.
And that number is 888-592-1817. Or you can visit their website. You can see it on the screen at galenhope.com. There is no shame in this. This is life-saving, without being so emergency-like, but it is really
Right.
a life-saving moment that one needs to really confront.
Right. And even if we are not the place for you, for whatever reason, if we are not the people that can help you, we will always direct someone to resources that can help you. So that is something we offer free of charge. We will talk to anybody and try to direct them to where they can get the help they need. So absolutely give us a call, because we feel like it's not just that we're providing services within Galen Hope. We want to be a resource for the whole community.
Absolutely. And we have only a couple of seconds left. What is the message that you want to leave today? We'll have you back, because I really think this is a very, very important moment in our community. We're coming out of a pandemic, and we can
Yes.
talk about that and what that's done to our
Yes.
young folks, if you want to address that or something else.
Well, that I always say that's the next pandemic is, and we're going to be dealing with this for many, many years, that what the pandemic has done to young people has really been catastrophic.
Because you speak about isolation, and there's been no greater time for these young people than that event.
Right.
Of being isolated from their friends, from what they know themselves, and no one to share that moment to moment, day to day with.
And, they're developing. They have certain developmental milestones that they need to hit in order to successfully progress to that next developmental stage of being a young adult and being able to live independently. And I think what we saw so clearly in the pandemic was that the teenagers wanting to be out and social and challenging their parents isn't just a thing they do because they're teenagers. It's because they were biologically wired to do that. And the pandemic.
Say that again, because I think that goes amiss, because you just say, oh, they're just so ill
Right.
behaved.
They're being bratty. They're limit testing. They just want to be with their friends. But actually what we now know for sure, I mean, I think we knew it before, but we see it so clear, is that they are biologically wired to be out in the world exploring. Their brain is developing, and they need to have experiences outside of the family. They needed that for their development on many, many levels. And when that got thwarted by the pandemic and everything being shut down, they really turned in on themselves. And then we had the addition of just being on social media all day long. And that was like gas on a flame. Yeah. So let's talk about that next time for sure.
Okay, definitely.
Yes, yeah.
She already tells me what I'm going to be doing, but it's really important, because it hits so many areas, not the eating disorder and the mental health arena,
Right.
and the marriage of those two is so important to address. So if one is having a situation at home, or family, friend, yourself, reach out to Galen Hope. They are located in Coral Gables. The number again is 888-592-1817. Dr. Amy Boyers is a magician, and she really loves what she does, and she does it with full heart. And I can't speak enough to this subject, and to fitting in and feeling good about your life. So I want to thank you
so much
for coming and
Thank
right
you.
down the street from Coral Gables. She had to take a canoe today from this rain. May you all stay safe at home.
Yes, thank you all.
And I appreciate you being here with us, and for you for tuning in. And give Galen Hope a call if you need, and they're always there for you. And I'm Fara Sax, and this has been the Community Voice.